In tonight's Health Watch, peripheral arterial disease is a condition that affects nearly 8 million Americans, but a lot of people mistake the symptoms for something else.
Now, most cases can be managed with medication and a change in lifestyle, but sometimes a more serious approach is necessary.
I couldn't walk very far, and there was no, I couldn't walk maybe 50 yards at the most, and after I was sitting down, taking a break for 5-10 minutes, and then I could walk again. And excruciating pain when you've got, when I have that blockage there.
James Margeson lived with chronic pain for a long time related to his peripheral arterial disease.
There's virtually, there's no golf or walking on a golf course. If you go fishing, it better be a short trip, it's just waking up in the middle of the night with leg pains, tremendous amount of times of pain if you try to push the issue and like walk too far.
Dr. Nicholls is a vascular surgeon at Southwest Washington Heart and Vascular Center. He recognized the symptoms that James was describing right away.
James came to me with a fairly straightforward story of having problems in his leg that occurred after he walked a very short distance indeed, about a quarter of a block to half a block. He started to get cramping and pain in his leg that made him stop, at which point the blood flow caught up, so to speak. The pain went away, but when he resumed his exercise, it came back again very rapidly.
So Dr. Nicholls worked to find the right treatment to get James back on his feet.
We inject dye or contrast material into the arteries and take a sequence of x-rays so that we can actually see where the narrowings are or the blockages are, and then we make a plan as to what, in concert with the patient's symptoms, may be reasonable options for intervention or doing either what we call an endovascular procedure, which people will think of as balloons and stents and rotor-rooters and those kind of things, or sometimes bypasses with open surgery.
James had already gone through a bypass surgery, so Dr. Nicholls suggested they try a minimally invasive procedure.
He's an excellent example of that because he had an operation for this problem on one side of his body. He had the same problem when he presented to me, actually with a more severe aspect of it, and yet we were able to do this all through basically needle access.
With that needle, Dr. Nicholls inserted a catheter through the narrowed artery, then a balloon at the end of that catheter inflated to open up the artery and improve blood flow. The procedure has fewer risks than surgery and less downtime. Just ask James.
Playing golf whenever I want. I could ride the Harley whenever I want. I'd go fishing whenever I want. Just playing yard work. I mean, simple things out in the yard, you can do all of that. Just like having your life back.
Well, Dr. Nicholls says that some of the risk factors for vascular disease include smoking, diabetes, high blood pressure, and cholesterol problems. He suggests that if you have any problems walking or have pain or cramping after walking, make sure you talk to your doctor. You can also take your health, your vote poll on lifestyle changes to reduce vascular disease online. That's at kptv.com.